Hi, I'm Dr. Matson. Today we're talking about population health for nurses. We're following the Openstax textbook. We are covering chapter 16, which is creating a healthy community. We're going to cover today the community as a client or patient. What is a healthy community? So we'll talk about that and define it, and also use the nursing process as a framework for this community as our patient. So by the end of this lecture, what you should be able to do would be to explain how a community can be a focus of care, and then also describe a community by its location, population, and social system, and develop a community profile. So, the broad definition of a community is a group of people with at least one characteristic in common. So, in a population or in community based nursing, nurses work to address a community's collective health instead of their individual needs. This is achieved through formal and informal methods, and that's because communities can exist in these ways. And this can span towns and cities. So, individuals do not have to live within a mapped boundary to be part of a geographical community. So, key activity for geographic communities could be things like civic engagement, involvement in issues of public concern through political and non political processes. So, here's an example of that. This is a protest, it's a form of civic engagement, and these can be important to inform members of public issues, mobilize voters, and community members act to change and influence the policy process. So, this would be an example of those rallying around climate change, and this could be considered a geographic community. Other ways that communities can form would be through social media and other social system. And these are really um, able to happen more now than ever because technology has dramatically enhanced these opportunities for people to join communities. And many people use social networks to participate in civic engagement, learn about health issues, and try to affect change. And this can happen through story sharing, knowledge sharing, organization, and advocacy for political and societal changes. And social media has then influenced the visibility of these issues and allowed people to advocate through these platforms. So, the very first part of taking care of a community as a patient would be assessment. So, this is where we use that first step in the nursing process, and we're looking at gathering data. And this is done, as you know, through a windshield survey. So, nurses are exploring communities and neighborhoods either on foot or in the car. And from there, data can be obtained, like the condition of the sidewalks and public spaces, how noisy is the community on this, or the levels on the street. What's the street activity like? Are there businesses there and places of employment? So other ways that data can be obtained would be through census data and publicly available reports and other public documents. So these sources are typically open and allow for an assessment of community. Additionally, nurses can consult key community partners, policymakers, community leaders. So these are the stakeholders. And this can be done through interviews, conversations, surveys. And really, it's very important that communities are involved in this process as well from the very beginning. So, Gordon's functional health patterns provides a method for structuring community assessment and organizing the data. The nurse theorist Major Gordon developed the functional health patterns to guide nurses through a thorough assessment of individuals and families. And this was done in 1982. So, 10 years after the work was published, scholars used it to develop a community assessment tool. So these 11 functional health patterns are adapted for use in community assessment, and they like I said, can be used to develop this community profile. So this community profile is made where the health problems are identified. So the descriptions of health risks and health promotion activities that apply to the community. And other assessment tools are available. So the American Hospital Association tool and the CDC action model tools also can be done. But you can see here in this table on the left are the patterns, and on the right are the key assessment items. This information is then gathered and structured and organized to create this community profile, then will be used in later steps in that nursing process. So by the end of this next section, you should be able to identify key characteristics of a healthy community and explain the Robert Wood Johnson Foundation Culture of Health Initiative and describe the Robert Wood Johnson Foundation framework. So the work of Robert Wood Johnson Foundation was inspired to support improvements to the American healthcare system. So Johnson recognized this really essential role of nurses in quality care. So the two goals were to give nurses a greater say in patient care and professional nursing, and then also to be able to improve population health, well-being, and equity in America. It identified 10 principles of a culture of health, and this operates under the knowledge that health is not just the result of individual choices and behaviors, but there are other factors that influence this, and they're very complex and they shape health. And nurses are instrumental to be a part of this process because of the time that they get to spend with patients. So this model really is looking at community-based determinants of health, care access, economic stability, housing, food, as opposed to just interventions for specific disorders and conditions. So the framework involves some key steps. So the first is making health a shared value. The second is fostering cross-sector collaboration to improve well-being. The third is creating healthier communities. And the fourth is strengthening integration of health services and systems. And here is an example of a healthy community. So you're looking at a library, and in this library, there is a focus on health. You have blood pressure screening, reading groups that are happening, and all of these community events have this health-focused integration between health promotion and disease prevention. So for this next section, you're going to need to be able to explain the nursing process as it serves as a framework to gain a holistic perspective of the community and population, and also use that to serve as a framework to plan evidence-based nursing interventions within the community. So the nursing process, the nurses use this process when caring for individual patients, but it also is a framework for caring for the community. So you know that you have these 5 steps: assess, diagnose, plan, do your intervention, and evaluate it, right? But now we're building on this and we're framing it in that community aspect. So when doing this, that first step is the nurse collecting data about the community through an assessment. Like we said, data is collected through a windshield survey, the informant interviews, and that publicly available census data. In the next step, that diagnosis step, the nurse is analyzing that data to identify key areas of opportunity for the community's health. Then the planning stage involves determining the goals or desired outcomes of the community interventions and developing a plan to progress towards them. And then the implementation phase, this is where we have our interventions. So the nurse is carrying out the health program. And then the fifth step, the nurse is collecting new data to determine the progress toward the identified goal and outcome following a community program or intervention. So this evaluation helps the nurse make evidence-based decisions about the intervention's results. In wholesome, this is applied to a community-based nursing. This is calling for a thorough understanding of the barriers and facilitators of health in the community. So in order to best address the community needs and develop partnerships, a thorough assessment is needed of these components and should be conducted in the assessment stage. This is health services, community priorities, health risks, local policies and practice, and other aspects and dimensions of community health. That covers our content today.